This video provides information from the internet, and we do not promote any products or medicines. Always consult a doctor before using any medication. We are not responsible for any side effects or issues resulting from self-medication.
DoxyCet LB Capsule is a combination medication that effectively treats bacterial infections and manages antibiotic-associated diarrhea. This unique blend serves a dual purpose, enhancing gastrointestinal health. Indications and uses. This medication is indicated for adults at risk of intra-abdominal bacterial infections and is also useful in managing diarrhea that can occur due to antibiotic use. By addressing both the infection and the side effects associated with antibiotic treatment, it helps restore balance and comfort in the gastrointestinal system. How it works. The antibiotic component accumulates in bacteria and inhibits protein synthesis, while the probiotic helps restore the gut's natural flora, improving digestion and overall gut health. Directions for use. Take the capsule as prescribed by your physician. Swallow it whole with a glass of water, do not crush or chew it. The healthcare provider will determine the appropriate dosage and duration based on individual factors such as age, body weight, and specific health conditions. Possible side effects. Common side effects may include loss of appetite, nausea, vomiting, and diarrhea. Consult a healthcare professional if symptoms worsen or persist. Precautions and warnings. It is crucial to take precautions before using this medication. Notify your doctor about any allergies, pre-existing conditions, or other medications you are taking. Pregnant or breastfeeding women, as well as children under 8 years old, should avoid this medication. FAQs. 1. Can it be given to children? No, it is not recommended for children under 8 years due to the risk of tooth discoloration. 2. What if I forget a dose? Take it as soon as you remember, but skip it if it's almost time for the next dose. 3. Can I stop taking it? Continue until advised otherwise by your doctor. 4. Should it be crushed? No, swallow it whole with water. 5. Can it cause vomiting? Yes, if it does, stay hydrated and consult your doctor if it persists. Thank you for watching this video. If you have any questions or suggestions, feel free to leave a comment below. Your feedback is valuable to us.